Dr. Ahluwalia, we've been talking so much. Good morning. Always happy to see you on a Monday morning. So much about the measles lately. And then New Jersey Governor Chris Christie came out and said something. What did you say this weekend?
So he was saying that parents should have a choice whether to vaccinate their children or not. But it seems like he's kind of backtracking a little.
So, yeah, so he said parents should have a choice, but he said my kids are vaccinated, so that should explain what my choice is. And it's interesting because, you know, what's happening now is a lot of doctors are refusing to take patients or kids who are not vaccinated into their practice. Because if you think about it, if you have children and you take them to your pediatrician, and in the waiting room are kids who have not been vaccinated, who potentially may have the measles, if your child is under a year of age,
and breathing that hours later, they're going to get it, right?
So I understand that we have to have this balance between choice and the ability to, you know, do what's right for your children. But on the other hand, there's a responsibility to society.
More and more groups, like baby groups, are saying if your baby's not vaccinated, they can't come to a learning group.
Right. And we talked about the fact that, you know, if you're truly concerned about the vaccines, you know, space them apart. You don't have to give them all at the same time, but please be responsible and have a reason why you don't want your children to be vaccinated.
Okay. This next topic, a big move from a state senator that's introducing legislation that would raise the minimum age from smoking from 18 all the way up to 21. Good idea, bad idea?
So the American Lung Association has put out these statistics that say that 9 out of 10 kids take up smoking before the age of 18. So we all know that kids get hooked onto cigarettes at a young age. And so what we want to try to do, or what they're proposing, is to increase the age. Now, we did this for drinking because there was a correlation between the age of drinking and the car accidents, right? So we have, you know, there's the issue of rights, right? If I can go fight in a war, why can't I smoke? So the issue is, you know, personal health versus societal health. And so, you know, if you could just sit in your room and smoke by yourselves, perhaps we wouldn't be as concerned. But as a society, I mean, these are kids, these are people we need to really take care of. And society, secondhand smoking, kids, you know, there's a lot of issues involved.
I don't know, this question might sound ignorant, but is there a correlation at all between drinking and smoking? At times it does go hand in hand, so I don't know if that's a fair question to ask.
It's absolutely right. I mean, you know, a lot of people smoke socially. So when they drink or when they're out with their friends or, you know, things like that. So
you get hooked when you're a teenager. My dear father-in-law, who passed from lung cancer not too long ago, started smoking as a young kid, you know, obviously a long time ago. But I still see these kids out of high school, they're skateboarding, they're young teenagers, they've gotten cigarettes somehow after school, and they're smoking, skateboarding, and you're like, you're babies.
You know, this is a problem, and we're trying to address it. Unfortunately, you know, it's a difficult problem because smoking, once you get addicted to it, it's really hard to get you off it. So we're trying our best to not have our kids addicted to it, but it's definitely going to be a debate.
Do you think it's a good idea then?
I definitely think it's a good idea. But you know, the question is how effective is it going to be?
They're still going to get it.
I don't want our kids to smoke, but you know,
still going to get it.
The risk of colon cancer for people under the age of 50. So is this shocking, or?
So we don't want to scare people. Right. So
it sounds scary when you say it.
The rate of colon cancer has been going down every year, 1% a year since 1974.
Is that because of colonoscopies?
It's because of screening. And we've done a great job at it, and we're very proud of it. But what we found is that, so first of all, 90% of the cancers are in people over 50. Right, so people under 50 can be assured that most of the cancers are in the higher age group. But what we found is that the people under 50 is where the risk of colon cancer is increasing. And this may be our diet, this may be environmental risk. We are not really sure. But if you have a history of our risk of colon cancer, so personal history, family history, if you drink, if you smoke, if you have some sort of an inflammatory bowel disease, you should be a little more concerned. You know, I haven't had a colonoscopy yet, but you know, this is something to watch out for. If you have blood in your stools, if you have change in your bowel pattern, you know, these are things that you should look into and not just ignore as a young adult.
Okay, Dr. Ahluwalia, always great to see you.
Yes,
Thank you.
Great to see you too.
So when we come back, we are going to talk about the Super Bowl and the commercials. We're just mentioning this. Some of them, you know, super big experience. Some of them were just amazing. Some of them we said were a little depressing. We just showed it, actually. What was the best? What was the worst? Super Bowl commercials coming up next.
Did you have a favorite one yesterday?
There were really good ones, but that child one was...
Wasn't it depressing?
It was...
I was surprised.
I know. I agree.
Yeah.
And I was saying, I feel like since we have seen so many of the commercials before the Super Bowl,